Okay, welcome everybody. Good morning. My name is Jenna Sistad and I am with the Ocean Monmouth Health Alliance, and I am joined today by my colleagues Marlene Alvarado and Diana Rios. A little hello, ladies. Today's webinar series is called Our Health to Hold. This is something that OMHA has been doing with partners from the start of the pandemic. And today is our very last presentation of 2022.
Oh, I'm going to use the computer.
I can't believe that I'm saying that, but we have many more opportunities you'll hear about to engage with us a little bit later. But today I would like to thank you all for being with us and let you know today's session is being recorded. So if you're not interested in being on camera, please turn off your video and keep yourself muted. There will be an opportunity for questions and answers at the end. Today we have Mildred Rivera of the VNA's Community Health Centers, our federally qualified health centers in Monmouth County, and we'll be hearing all about the wonderful services that they have to offer. Before we start, I just want to make a quick plea out there. Is there anybody here that needs us to do this presentation in Spanish as well as English? Diana, would you mind? Thank you.
Buenos días, hoy es nuestro programa que tenemos mensualmente con el Ocean Monmouth Health Alliance. Hoy va a hablar Mildred Rivera, un representante de nuestras clínicas central en los áreas del condado de Ocean y Monmouth. Y queremos saber si alguien hoy necesita traducción para esta presentación. Si necesitan traducción, favor de dejarnos saber en el chat o decirlo verbalmente.
I'm gonna mute because I don't think that's somebody saying they have the need, right?
No. Okay, she muted herself. Okay.
Yeah, I muted. Okay. And so the only other thing that I'll ask is I see some of our partners already who are here have started to do this. If you wouldn't mind letting us know who's with us today by putting your name and your contact information and what organization you represent into the chat box. And as we do that, I would love to welcome Mildred Rivera of the VNA Community Health Centers. Welcome, Mildred. Thank you for being here with us.
Hi, no problem. So my name is Mildred. I am with the VNA Community Health Center. I am the I'm the Community Health Outreach Specialist, and I'm just going to go over our services and what we offer our community health centers. One second, it's a little. Like I said, we're the VNA CJ Community Health Center. Our mission is that we work across our 4 locations to fulfill missions of building healthy communities and enhancing well-being with a diverse and multilingual team of professionals. And we aim to reflect the New Jersey community, focusing on expanding access to high-quality healthcare in a trusted and inclusive environment. And then below that is our website. If anybody's interested, it's the VNACHC.org. As I mentioned, we do have 4 different locations, and they're listed on the side. So it's Asbury Park, Keyport, Red Bank, and our Red Bank office will be moving eventually. And then Freehold is our last location. So insurance and payments. So we accept Medicare, Medicaid, commercial insurance, self-pay, and workers' compensation. Since we are a federally qualified facility, we have a sliding fee scale, which is to assist the under and uninsured patients in need, meaning that the quality of care is never dictated by the ability to pay. This is based off income and household size. So for a patient who does not have any insurance, we do require them to bring documents in. So first would be identification. It doesn't matter what their immigration status is, as long as they have some type of valid identification, whether it be from their home country or just here, the county, the state, it doesn't matter. And then proof of income, and then proof of address. When they make appointments, they will give them all this information so they know what documents they have to bring in. So our services, we have primary care for the entire family, which is regular checkups from newborn to adult years. We have prenatal care from regularly scheduled prenatal visits to delivery and postpartum visits, as well as the assistance of a social worker. We also have the Ryan White program, which is primary care for individuals who are HIV positive. We also have behavioral health, which is the licensed clinical social worker, works directly with a primary care provider to address mental and emotional well-being of the patient. We have podiatry, which is foot care, anything lower than the leg they'll take care of, which is foot, ankle, and lower leg. We also have nutrition counseling and diabetes education to promote, to promote positive behavioral and health style changes while helping build healthy eating habits and manage conditions. We also have a chronic disease education. Physicians provide care of chronic diseases, where it's diabetes, high blood pressure, as well as communicable diseases like hepatitis or COVID. And this is for people of all ages. We also have a chiropractor. And then we have our support services. So patient navigators, they assist patients with complex health needs and connect individuals to community resources, whether they need referrals or they need help making appointments, transportation, we can help with that. We also have the cancer education early detection, which is SEED. Patients that are uninsured or underinsured receive low cost or free cancer screening like mammograms, PAP, colon cancer, as well as prostate. And we also have health insurance assistance. So when the patient comes in and if they're eligible to enroll in public or private health care coverage, we help them with that. We also have our 340B program, which provides discount on prescription drugs to patients that are eligible. So if patients that have insurance, they can use that program. Or if a certain medication is not covered under their insurance, they can also use this program. And lastly, we have additional services, which is certain services are not offered at all 4 locations. So for example, dental care is only in Asbury Park and Keyport. We have dentists to offer a wide range of dental care for all ages with vitamin fee scale prices. However, they do not do extractions and they do not do braces, but they do have dentures, so they can install dentures. We also have our medication assisted treatment program, which is MAT at Asbury Park, which provides a whole patient approach to treatment of substance use disorder. So anybody who's struggling with substance abuse and type of drugs, they can help them at least the first step to recovery. We also have our LGBTQ+ in Asbury Park and Freehold, and we also include transgender services within that. We also have women's health, which is in Asbury Park and Freehold. We have an OBGYN that provides gyno exams as well as birth control. We also have geriatric specialty care, which is only in Freehold. We provide care to seniors to ensure they can maintain the most active and independent lifestyle as possible. And lastly, we have sports medicine in Freehold, which provides services ranging from pre-participation sports physicals to injuries due to physical activity, as well as injection to the joint. And that's for like an overall of our services. And on the screen is my information, my email, and then my work cell phone number.
Thank you, Mildred. Every time I hear a little bit about what the VNA is offering, I'm that much more impressed and that much more intrigued. So thanks for giving us a highlight of everything that's offered there. We have a manageable group here today. So does anybody have questions for Mildred? If so, please feel free to take yourself off mute or write them in the chat. Hopefully she can answer them for us.
I have a question. It's about the dental. Hi, Mildred. How is the wait time for dental? I know that dental is a major thing in a lot in the community, and sometimes that can take a long time to get in.
Yeah, so right now there isn't, maybe like a few weeks out, but there's not really a hold on dental. We can get them in. The only place that we have somewhat of a delay is the Freehold office, because right now we're all fully booked till December.
Wow. Okay. Freehold. All right. So a few weeks. Thank you.
And keeping in mind that it's only Keyport and Asbury for the dental services, right, Mildred?
Yes.
Okay. What about transportation to any of the services? So say somebody that lives in Freehold or Red Bank needs dental, how would we be able to possibly work with that family to get them the service, even though they don't live close by one of the sites that offers it?
Yeah, that's a good question.
We do have, look at the name, I think it's Easy Ride that we had a partnership with. We were doing patients who needed MAT, but there's just like substance abuse, or like if they needed like any type of immunization, we would give them transportation or cancer screening. I have to verify that's still going on because there was a obviously an amount that we couldn't go over, but I can get more information for you to see what we have available from that partnership grant.
Okay, wonderful. Welcome, Dr. Schlimbaum. I see that you've just joined us. We appreciate your time today. We were just talking about transportation opportunities from one of the sites to another if they needed a specialty service like dental. And so if you had anything to add to the presentation or to that, to answer that question, we'd love to hear from you.
No, I don't really have anything to add. Thank you. Sorry, I'm a little bit late. We are, we found that maybe Mildred had covered this, but we found that the offerings for transportation have been underutilized typically, and we're not sure why. Sometimes it can be a little cumbersome to arrange these, and but I think I don't know, it may be a marketing situation or what have you, or it's just I don't know, but typically there are so many transportation issues, but typically we gear up to address those, and then they're not utilized. So maybe a deeper dive into the reasons for that would be helpful.
Okay, and then we, on our end, we can add a couple of points about transportation. Diana, do you want to kind of take us through what OMAJ and HER and SEED could help with for transportation in a smaller capacity?
Well, Dr. Schlimbaum, I right now help manage the grant for the SEED transportation for those patients that have qualified to go get free screenings, free cancer screenings. We use Uber Health. I also have a smaller grant that's for survivors of cancer. You don't have to have the cancer now, just being a survivor or having it, either way. We provide support by providing also Uber rides, whether they need to go to the grocery store or to make an appointment or to pick up prescriptions. So that's a little bit more flexible. And what we do is we reach out to them directly. We explain to them how it works. And we give them all the information they need and explain how Uber works, that it is free. And it's been working pretty well. I've reached out. It all started with getting the word out with the local hospitals, some of the patient navigators out there that were working with folks that are either cancer survivors or having cancer treatment. But I'm sure that if we reached out to maybe the hospitals through Charity Care, the ones that manage those cases, they can recommend our centers and then let them know about the transportation. That might be an option too, to let people know.
I appreciate that, and it sounds like you've got a better situation going, and we could learn from that for sure and collaborate.
Yeah, and anything you need in terms of help with that, I can totally assist you guys with that.
Okay, thank you.
No problem.
Thank you, Dr. Schlimbaum. Diana. Does anybody else here have a question for Mildred or Dr. Schlimbaum?
I had a question. I'm not sure if you guys went over it in the presentation, but regarding the sliding fee, I saw that one of the requirements was like a proof of like a pay stub. What would be the like, what if they didn't have like, what if they're getting paid like under the table or didn't have like some form of like proof of like payment like that? Was that something that they could still like try to work with them for?
Yeah, so if they don't have like actual pay stubs, they just need it could be a handwritten letter from whoever they're working with saying that they are employed there. And I believe they have to have how many hours they work per week, if they get paid weekly, bi-weekly, and then the amount they're getting paid.
Okay, thank you.
Good question, Edgar. Is there anybody else that has a question?
Hi, how are you? Hi, Mildred.
Hello.
Thank you for that presentation. Angelica Espinal Garcia forwarded me this link. Last Saturday, we started a women's support group. I just wanted to see if I could probably email you potential dates to come. We're meeting once a month, but I would like, you're bilingual, I'm assuming? If
Yes.
not,
Yes.
okay. And to just reach out to the community, the women that are showing up, they have gone through some trauma and things like that. So just wanted to see if I can email you and see potential dates as to coming and speaking to us at Casa Freehold, just to let them know what resources are out there.
No problem. My email's on the screen already. You can just email me and we can coordinate something.
Thank you so much.
And I can go ahead and put that in the chat for everybody too, to make sure they have it readily available. Other questions? I did see some other people take themselves off mute before, so feel free to go ahead.
Yes.
Hi, this is Kathy
Good
Balto.
morning. Sorry.
All right, go ahead, Gladys, go, and then Kathy, you go right after Gladys.
Fantastic. Thank you. Thank you so much. Again, this is Gladys Cartagena, formerly from United Healthcare. Now I'm working with Aetna. I just had a question regarding the transportation. Is that something that the patient have to reach out to a specific department within the VNA, or they can actually access this on their own to schedule for appointments?
It's usually through us, through the CHC, to the community health center. So I know the VNA has different branches, so it has to be through the community health center. I can, like I said, you can email me or call me, and then usually what it was is the patient will get in contact with us, and then we get in contact with a third party and let them know the pickup time, the location, where they have to be, and then the patient just has to be ready at a certain time and just look for the car, and they will come out, and that was pretty much just like an Uber.
Amazing. And this is only strictly for cancer patients, is that correct?
So SEED has their own transportation from what I'm seeing. The community health center has a separate one. Like I said, I have to get more information on it.
Fantastic. Thank you, Mildred.
No problem.
Go ahead, Kathy, you're up.
Good morning. You may have covered this part already, but I missed it. How are patients made aware of this and other resources? Is it the hospital, the doctor that they're being treated? Is it, how do they know that these services are available? So I feel like it's a dumb question, but.
No, it's okay. So I do a lot of outreach, for example, with Neighborhood Connections. So every time we do events, I always let everybody know about all our services. Our website has our information with all our services as well. And if you come into our office, there should be a pamphlet already there telling you all the services that we have available. I'm pretty sure that once the provider, like if, for example, if a patient needs other additional resources, the provider should be able to guide them and let them know that we do have additional resources, whether it's free cancer screening, or we have a gynecologist or a chiropractor on site. That's something that the provider should know and then refer them to.
Great, thank you.
Anybody else? Does anybody else have a question for Mildred? No? Okay. All right, so we can start to wrap up here. Basically, I mentioned in the beginning that, you know, Ocean Monmouth Health Alliance was doing this on, you know, Wednesdays, once a month with some wonderful community partners like Mildred and the VNA Community Health Centers. We thank them all for being part of this series with us. We hope to be able to continue to do this in 2023. So look out for more information. And in the meantime, there are some really great events that we have coming up. So I'll just quickly mention some of them. The first one is on November 2nd. Ocean Monmouth Health Alliance hosts a quarterly meeting where partners come together and everybody gives updates about what they're doing in the cancer and chronic disease prevention world. So that's at 10:30 via Zoom. On November 5th at the Asbury Park Library, in collaboration with the SEED team, we're offering some HPV education and a video screening where you can watch a film following the lives of 5 women diagnosed with HPV. So that's open to anybody. It's free. A light breakfast will be offered, and that's at 10 a.m. to 12 p.m. Then on November 16th at 4:30, we have a collaboration with Rutgers Cancer Institute of New Jersey, as well as SEED, where we're going to be learning about health equity and lung cancer prevention in the LGBTQ community. And then SEED will be presenting on all the services that they offer. So we hope you can join us there. And then finally, at the Freehold Family Health Center, which you heard about today from Mildred, through a collaboration with Neighborhood Connections to Health and SEED and the VNA, of course, we're offering what we're calling a turkey smokeout. So this will be an opportunity for people to access quit services, smoking cessation services, and different resources, as well as some screenings, lung cancer screenings offered through Centrastate. And Fulfill is also offered to donate 100 turkeys to the event. So families who come, the first 100 will get turkeys to go home for the holidays with. And we are still looking for donors to help us out with all the fixings, right? So we have the turkeys, but the mashed potatoes and the corn and the other things that go along with a Thanksgiving meal. So if anybody here is interested in collaborating with us on that and has a connection to make that kind of a donation, we would welcome it. And again, that event is on November 17th, and it's going to be from 10 a.m. to 12 o'clock p.m. at the Freehold Family Health Center. So there's just a couple of things that we have going on through the remainder of the year, and we hope to see you at some of them. And please let me know if you have any questions about anything that I mentioned or any last questions for Mildred today. No? Okay. Well, with that, I thank you again, Mildred, for your presentation today. Thank you to the VNA Community Health Centers, and thank you everybody for attending. Be well. We'll see you soon.
Thank you.